Want to score over 850 in your HESI fundamentals exam? Then let's get started. Question 1. A client with diabetes asks a nurse why regular foot exams are necessary. How should a nurse respond? Foot exams help monitor for signs of arthritis. They ensure proper circulation to your feet, to check for wounds or infections that may go unnoticed, to assess the size of your feet for appropriate shoe wear. Pause the video and select your answer. If you chose option C, you are correct to check for wounds or infections that may go unnoticed. Regular foot exams are crucial for clients with diabetes because they are at higher risk of developing foot ulcers and infections due to neuropathy and poor circulation. These exams help detect any early signs of wounds or infections, preventing complications such as diabetic foot ulcers. Question 2. When preparing to administer medication via the intramuscular route, which angle should the nurse use for needle insertion? 45 degrees, 60 degrees, 90 degrees, 120 degrees. Pause the video and select your answer. If you chose option C, you are correct, 90 degrees. The intramuscular route requires a 90-degree angle for needle insertion to ensure proper deposition of medication into the muscle tissue. This angle allows for optimal absorption and effectiveness of the medication. Question 3. A client presents with shortness of breath, rapid breathing, and decreased oxygen saturation levels. Which priority intervention should a nurse implement first? Administer oxygen therapy, assess vital signs, administer a bronchodilator, notifying the healthcare provider. Pause the video and select your answer. If you chose option A, you are correct. Administer oxygen therapy. Administering oxygen therapy is the priority intervention to address hypoxemia and improve oxygenation. It helps support respiratory function and tissue oxygenation, which is essential for the client's well being. Question 4. During a physical assessment, the nurse notices that the client's skin is pale and cool to touch. Which condition could this indicate? Hyperthermia, hypoglycemia, hypertension, hypoperfusion. Pause the video and select your answer. If you chose option D, hypoperfusion, you are correct. Pale and cool skin is indicative of decreased perfusion, suggesting hypoperfusion. This could be due to inadequate circulation of blood to the skin, which may result from conditions such as shock or peripheral vascular disease. Question 5. When assessing a client's level of consciousness using the Glasgow Coma Scale, which response would indicate the highest level of consciousness? Eye opening to verbal command, localizing pain, verbal response, oriented to time, place, and person. Pause the video and select your answer. If you chose option D, you are correct. Oriented to time, place, and person. Being oriented to time, place, and person indicates intact cognitive function and awareness of surroundings, reflecting the highest level of consciousness on the Glasgow Coma Scale. Question 6. A client with heart failure is prescribed furosemide. Which electrolyte imbalance should the nurse closely monitor for? Hyperkalemia, hypokalemia, hypermagnesemia, hypomagnesemia. Pause the video and select your answer. And guys, I know you've seen this question a couple times, but I cannot say how important this question is because as a nurse, this is one of the most important electrolyte imbalance you should be looking for. If you chose option B, you are correct, hypokalemia. Furosemide is a loop diuretic that can cause potassium loss, leading to hypokalemia. Monitoring potassium levels is crucial to prevent complications such as cardiac arrhythmias. Question 7. Which intervention is essential to prevent ventilator-associated pneumonia in a mechanically ventilated client? Elevating the head of the bed to 30 to 45 degrees, limiting oral hygiene measures, administering antibiotics prophylactically, providing continuous sedation to keep the client immobile. Pause the video and select your answer. If you chose option A, you are correct, elevating the head of the bed to 30 to 45 degrees. Elevating the head of the bed to 30 to 45 degrees helps prevent aspiration and reduces the risk of developing ventilator-associated pneumonia by promoting drainage of secretions and preventing pooling of oral or gastric contents in the airway. Question 8. A client who underwent abdominal surgery complains of abdominal pain and distension. Which action should a nurse prioritize? Administering a laxative to relieve constipation, encouraging the client to ambulate, applying a heating pad to the abdomen, assessing bowel sounds and reporting to the healthcare provider. Pause the video and select your answer. If you chose option D, you are correct, assessing bowel sounds and reporting to the healthcare provider. Assessing bowel sounds can provide important information about gastrointestinal motility and potential complications such as bowel obstruction, which could be causing the pain and distension. Reporting findings to the healthcare provider allows for timely intervention. Question 9. When providing care to a client with a central venous catheter, which action by the nurse is essential to prevent infection? Changing the dressing daily, using sterile technique during catheter manipulation, removing the catheter if the client develops a fever, administering antibiotics prophylactically. Pause the video and select your answer. If you chose option B, you are correct, using sterile technique during catheter manipulation. Using a sterile technique during catheter manipulation helps prevent introduction of pathogens into the bloodstream, reducing the risk of catheter-related bloodstream infections. Question 10. Way to go, guys. You made it to the end. A client with a history of COPD reports increased dyspnea and productive cough with greenish sputum. What is the priority nursing intervention? Encouraging deep breathing and coughing exercises, administering oxygen therapy, providing education on smoking cessation, notifying the healthcare provider for possible exacerbation. Pause the video and select your answer. If you chose option D, you are correct, notifying the healthcare provider for possible exacerbation. An exacerbation of COPD requires prompt medical assessment and management. Notifying the healthcare provider allows for timely intervention, which may include adjusting medications, initiating oxygen therapy, or providing other treatments to alleviate symptoms and prevent complications. Click that subscribe button and join us next Friday for another Fundamentals Friday.